is an introduction to biotransformation. So what is biotransformation? So if we break the word biotransformation into bio and transformation, bio means a living organism and transformation means chemical alteration. So biotransformation can be defined as enzyme catalyzed chemical alteration of drug within a living organism. So where does biotransformation take place? Biotransformation predominantly takes place in the liver. So most drugs undergo biotransformation in the liver. But other organs can also act as sites for biotransformation reactions. For example, intestine or the gut metabolizes tyramine and salbutamol. Lungs metabolize various prostanoids. In the plasma, hydrolysis of succinylcholine by plasma cholinesterase enzyme takes place. Then there are other organs such as skin, kidney, placenta which act as sites for biotransformation reaction. So all organs of the body can act as sites for biotransformation reaction and can be involved in these reactions. So why is biotransformation necessary? Biotransformation is necessary because the drug after administration gets absorbed from the intestine and reaches the systemic circulation and produces a therapeutic effect. But this therapeutic effect cannot continue for an indefinite period. The action has to be terminated. So termination of drug action is brought about by distribution, metabolism and excretion. The kidney is a major organ that is responsible for excretion of the drugs. Drugs that are excreted through the kidney are small in molecular size so that they are easily filtered through the glomerulus and removed from the body. Also, the drugs have to be polar in nature. So highly ionized drugs that are polar in nature, that are water soluble in nature, are easily excreted through the kidney. But what happens to the drugs that are lipid soluble in nature? Lipid soluble drugs are not readily excreted through the kidney because after filtration through the glomerulus, they are reabsorbed by the tubular nephrons by the process of tubular reabsorption. So this makes the drug act for a longer period. So they are not easily excreted through the kidney. So the basic principle of biotransformation is to convert the lipid soluble drugs into polar drugs so that they are easily eliminated by the kidney. So this is to facilitate the excretion of the drugs through the kidney. So biotransformation occurs in two phases. Phase 1 reaction and phase 2 reactions occur sequentially, which means phase 1 reaction is followed by phase 2 reactions for most of the drugs. However, there are exceptions. For example, isoniazid undergoes acetylation and forms acetylhydrazine, and this is a phase 2 reaction. The acetylhydrazine further gets hydroxylated to form hydroxylated isoniazid. This is a phase 1 reaction. So in this example of isoniazid, phase 2 reaction precedes phase 1 reaction. So this is an exception, but for most of the drugs, the phase 1 reaction is followed by phase 2 reaction. So what happens in these phases? So phase 1 reaction includes oxidation, reduction and hydrolysis, whereas phase 2 reaction includes conjugating reactions such as acetylation, methylation, sulfation, glucuronide conjugation, sulfate conjugation, glutathione conjugation and so on. In phase 1 reaction, there is functionalization, that is, a functional group such as hydroxyl group, amino group, sulfhydryl group is attached to a drug molecule, and this imparts polarity to the drug molecule to enhance the excretion of the drug. So if the drug is less polar, it goes into phase 2 reaction. So the conjugating enzymes donate a substrate molecule which attaches to the drug molecule and increases the polarity of the drug and facilitates the excretion of the drug. Phase 1 reactions are catalyzed by microsomal enzymes which are located in the smooth endoplasmic reticulum of tissue cells such as liver, intestine, lungs, kidney. Whereas phase 2 reactions are mostly catalyzed by non-microsomal enzymes which are located in the mitochondria and cytoplasm of tissues. Now moving on to consequences of biotransformation. For most of the drugs, a pharmacologically active drug gets converted into an inactive metabolite and the action is terminated in the body. For example, phenobarbital forms hydroxyphenobarbital, which is an inactive metabolite. But for some drugs, pharmacologically active drug forms an active metabolite. For example, diazepam, which is a sedative and a hypnotic, forms oxazepam, which is an active metabolite. So in this example, both diazepam and oxazepam are active compounds and they produce their own therapeutic action. The next example is codeine, which is an active compound and gets converted into morphine, which is an active metabolite. So both codeine and morphine are active compounds and they produce the respective therapeutic action. There can be a third situation where an active compound forms a toxic metabolite. For example, halothane forms trifluoroacetic acid, which causes hepatotoxicity. Methoxyfluorine releases fluoride, which causes nephrotoxicity. Paracetamol forms N-acetyl parabenzoquinone, which is hepatotoxic in nature and causes hepatotoxicity. Lastly, a drug can be administered into the body in the form of a prodrug. So what is a prodrug? A prodrug is a medication or a compound which is pharmacologically inactive and gets metabolized in the body to an active compound. For example, azathioprine is a prodrug, gets converted in the body into mercaptopurine, which is an active metabolite. Enalapril is a prodrug, it is inactive in nature, gets metabolized in the body to form enalaprillate and produces its therapeutic action. Prednisolone is a prodrug, it is inactive in nature and forms prednisolone in the body after metabolism. Levodopa gets metabolized in the body to form dopamine and produces its therapeutic action in Parkinsonism. So these are the consequences of biotransformation.
This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.